Hi, everyone. I wanted to touch base with everyone today because I was actually supposed to have a webinar, but Zoom is being really, really out of control. So I don't know what happened. We are on the back end, like trying to figure that out, but I wanted to still, show up for everyone. What I will do is I will go ahead and email everyone that actually registered for it, and what we're going to do is have another live a webinar. That's what I'm going to be doing next week, Thursday. Is probably what we will do. But let's kind of get into, personal branding. So, what I want to teach people just in life is this. We always have possible technical difficulties or whatever, what have you, right? But the show still goes on. You still have the responsibility to show up and say, hey, something didn't work, right? That's where you're able to show people that you actually have integrity, right? That you actually are an honest person, and, no one can fault you when actual, things kind of fail you, right? We can't fault you for that. So, one of the things just about myself is that I like to always be extremely honest, over communicate as well, and just explain my intentions. So, my intention, just for LinkedIn and any social media platform that I'm on, is I want to be a change, in healthcare. I want providers to be better providers. I want them to be visible. There's so many providers that are just seriously just amazing people, and we don't see them every day, right? We don't see enough of them. We don't see how your bedside manner is just amazing. We don't see how you cure, some of our children. We don't see how you take care of the sick. Um, we don't see all of that stuff. And I want everyone to know, number one, that I appreciate every single healthcare provider, and that, again, anyone that signed up, for, um, my webinar, please, I will put another link in a little bit. But hey, Beryl, thank you so much. And also, Catherine, I appreciate you guys. I know Beryl has done so many, different webinars, and he's out there, definitely connect with him. He is a force to be reckoned with. He's an amazing person that is in, the Jewish community, who is nothing but, a gold. He's just amazing. So definitely go ahead and connect with him. He is awesome. But, things aren't always, what they seem, right? So let's kind of talk about, personal branding. As I said, I'm going to make the best of it. So when I started in 2018, what I did was kind of found something, right, called LinkedIn. And I got on here and I used it basically as a resume. Right. So I'm like, oh, I'm Courtney Herring. I do this, I do that. And I didn't really understand, what LinkedIn, could be. Right. And what it has and what it is now is just totally, amazing. Yes, it's a professional platform. We totally all know that. Yes, obviously some people don't really use it as a professional platform, but again, we can't, let everyone, we can't control everybody and what they do, right? But the biggest thing that I wanted to say is that LinkedIn, actually changed my life, but not the platform, but the people that are on LinkedIn. I've met so many different people, not only in the healthcare world, but all around the world. People that are different than me, people that look different than me, people who have different religions, right? People who believe in different things, Democrats, Republicans. There's all different types of people that are on LinkedIn. But I will say that one of the main things, and the things that we all agree on, is that we believe in being professional, being intentional, right? And giving value, right, on this platform. And again, you can still, everybody knows that if you know me, I have also a very loud 5-year-old. There's nothing we can do about that, and it is the evening. But as I always say, our lives, are real. This is what it is, right? this is what we're dealing with. And I tell people this story a lot, that my son, when I had him, he was compromised health wise, and all I had, right, was the physicians and doctors and nurses and caretakers and people that cleaned and all of that stuff that could help me in the time that my child was, we didn't know what was going on with him, right? I tell people this story all the time because whenever your child is sick, or a loved one, right, but especially a baby, right, they can't talk, they can't walk, they can't tell you what is happening, but you know what, who can hopefully tell you is a healthcare provider. So that is all we had. So I try to explain, why am I so passionate about healthcare? Yes, I used to be a social worker, but I really, really dug into healthcare in an intimate way when my son was facing some really horrific battles when he was very young. I'm talking like 10 weeks old, right? And we didn't know what was happening. And obviously he's very healthy now. You can still hear him. He's probably playing Minecraft downstairs. But it was a miracle that he's healthy now. He did have a liver disease, and I know that all the doctors and everybody are going to say, gosh, how did the liver, get better? Listen, we don't know, but we just praise God every day that it did, right? But what I will say is, the only way that I was able to keep going as a person, right? Because I wasn't professional there, and I was a person that was taking care of someone else that needed care, is again the healthcare professionals that I had with me. Even though they said sometimes even the C word. The C word is unfortunately, it's cancer, right? You don't want to hear that when your son is 10 weeks old. Um, uh, you know, uh, it's a journey, right? And when all of that happened, and yes, I have a happy story at the end. I vowed that I was going to help healthcare professionals do the best that they can. And the way that they can do the best that they can is by being visible, by us getting to know them, and by us understanding that they are walking through the trenches, right? They're taking care of everyone, and a lot of times they don't take care of themselves. I had a surgeon, very, very bright woman, and Duke Medical, and she did everything, for my child, but it wasn't just mine, right? It was everybody else's. And it was amazing because sometimes you knew that she had to say things that were tough. And I'll never forget, one day she called me on the phone and she said, Courtney, we see certain things, right, in his levels or whatever, what have you. And, he might have this, the C word. And obviously, I almost died on the phone call. I'm not even going to lie, right? I have this little baby. And, but what was amazing, right, about her was that she took the time to call me, and it was after 9. And even though I got that crazy phone call, what was interesting was she still took the time, and I knew she was tired. So again, that's why I do what I do, because I want you guys to be the best you can be. I know that we're going through COVID, and I know that even with COVID, right, you're still having to deal with other, conditions that have nothing to do with it. So on top of those conditions that continuously happen, then we still have, a pandemic. So again, I wanted to get on here just to, introduce myself again. So I am Courtney Herring. I have built many private practices. I have a 5-year-old who is extremely loud, and he's all the way down in the basement. Okay, and I have a staff of different team members that build practices. We do medical billing, and I'm also a part of Growth Academy with Shanae Moray. And what we do is we want all of the healthcare providers to be visible. People come to me a lot and say, hey, I'm not getting clients. And I'm talking about clients or patients, right? And I say all the time that at least 78% of us look online to find a healthcare professional. We want to see your smile. We want to see, what have you done? And we want to see that you have a team that you're working with that you actually like, right? And it's not just the doctor, right? It goes all the way up to when you give all of your information and it's your insurance or whatever. It matters, right? All of that is very, very important. And because I got such great care, and all of the things that I learned just walking through a hospital with a child that was health compromised, um, I I learned to uh, just see things in a different way, right? You take things for granted when certain things might not have happened to you, right? But now I live life honestly to the fullest. I do whatever I possibly can for anyone. Honestly, people message me all the time, and it's funny because they're like, "Oh, you're even gonna answer?" Yes, I'm going to answer because I wouldn't be where I am today if no one answered my call, right? If no one helped me and my family, if no one picked up the phone and said, hey, you bill Medicare and Medicaid, hey, I have a hospital, that I'm opening, things like that, right? We all have to think about where have we been. This is real life here. So we all have to, think about where have we been and where are we going. And I still believe in the healthcare industry. I'm not saying that something is terrible, not at all. But I do think that we can all do better. But I think the only way that we can do better is, with certain people, and it might not be me, right? I might not work well with you or whatever. But if you are a healthcare provider, I just want you to be the best you can be. I want you to be able to take the insurance that you want. I want you to get the reimbursement that you need. I want you to do what you said that you wanted to do, which is to help people. And I understand that in certain situations, right? You guys might not only be able to see people for 15 minutes, right? I know that's not enough time, but that is something that maybe we can change, right? People, like me, just out here. So again, I just wanted to, introduce myself again and just tell all of you, sorry, so Zoom is acting crazy and I don't know what happened. But I will be back next Thursday and I will put an event up. And if the Zoom doesn't work, then I'll use, obviously something else. But I can't stress enough that when are just trying to do something, right? Things might not work the way that they're supposed to. And you know what? That's okay. I'm not going to sit here and cry in a corner, but I am going to show up for you guys and say, hey, the Zoom didn't work and something happened, but I'm here. So, all the ones that did sign up for the webinar, I will go ahead and personally go ahead and email all of you, let you know when we're going to have it again. And you can, again, in probably like 15 minutes, go to yougrowhealthcare.com. It's in my little bio and my feature, and we'll go ahead and change that. But again, healthcare providers, you guys are A1 people. But I do think that there's certain things that I can help you with, and just many other people that are very passionate about you. So again, thank you all. I hope you have a great day, and I am picking up a puppy tomorrow, and I'm super super excited. That might be why the Zoom's not working, but anyways, I'll take a picture of him tomorrow. And all right, guys, I'll stop rambling. I'm sure my team is like, get off of here. But anyways, I will see you guys soon. And again, thank you so much for your patience. And I'm going to be 42 on Saturday, and I'm excited for that as well. So there's a lot of things coming. All right.